Welcome to the emergency or the ER. So it's a busy place with people of different ages and incredible mix of injuries and illnesses. But there's one question probably everyone here asks themselves. Why am I waiting? Great question. So I think the first thing is to step back a bit and consider that the physical emergency room is actually interconnected with a much larger web of people and services right around the whole hospital, and sometimes beyond. From the highly specialized ER nurses in charge of assessing patients and keeping everything organized on the front lines, to the doctors on call, experts in surgery, obstetrics, general medicine, cardiac care, and so on to networks of testing services like labs, radiology, and imaging technicians. All these moving parts work in your favor if your problem is complicated or urgent, but it also means there are a lot of places where care may take more time and slow down, such as a lineup for the CT scan. And this can lead to waiting. Emergency rooms are carefully staffed with more docs and nurses when we know there will be more patients. But even so, like at a busy restaurant, when it's full, the waiting will be longer. The second concept, and this is key, is that unlike your local walk-in, the emergency room is not a first-come, first-served place. ER staff have to decide who needs medical attention most urgently, and they do this using a process called triage, which means to sort. The triage nurse you first saw actually especially trained to pick up on clues that might make your condition more time-sensitive. Suffering a run-of-the-mill chest or stomach pain from more serious cardiac event or appendicitis can make a big difference in your health. A triage is an art and a science, and your condition might change, and if it does, don't hesitate to talk to the emergency staff. The 4 basic rules of easy engagement. The first is that every patient can have one additional family member or friend with them in an examination room. Along with practical concerns, there's a need for patient privacy and safety. Patients are often separated only by a curtain. The second rule of engagement is to keep your mobile phone in your pocket or purse. Again, because of privacy rights, the examination room isn't a place for taking selfies or videos. Rule number 3, the ER is a major area for communicable diseases. So by keeping it clean and sanitizing the germs off your hands, you protect all of us. Rule of engagement number 4 is about making emergency departments safe for all patients and healthcare staff. And that's why there's no tolerance for swearing or aggressive behavior, and why there may be security guards to help ensure everyone's safety and enforce this rule.